We are Toronto Central CCAC clinical nurse specialists. As people age, they often require new, more, or different kinds of support to meet their ever-changing needs. As clinical nurse specialists, we work in collaboration with care coordinators to assess and support clients living with complex geriatric issues. These may include concerns about incontinence, cognitive impairment, behaviors, and falls, as well as overall functional decline. We use our specialized knowledge to support people like Mrs. B. At 72 years of age, Mrs. B was referred to the Toronto Central CCAC after she was admitted to hospital following a fall at home. A care coordinator visited Mrs. B shortly thereafter to conduct an initial assessment. During her home visit, the care coordinator identified a number of geriatric concerns. Mrs. B was socially isolated with minimal supports, was at risk of further falls, and was suffering from significant urinary incontinence, which was causing her considerable distress. The care coordinator referred Mrs. B to a clinical nurse specialist to obtain our advice about how to best support Mrs. B's specific conditions. Shortly thereafter, I visited Mrs. B to assess her needs and completed a detailed history of her urinary incontinence. Following my visit, I reconnected with the care coordinator to make a number of recommendations. To help address Mrs. B's risk for falls, I suggested the care coordinator engage an occupational therapist to ensure Mrs. B's rollator was repaired and being used to its best advantage. I also recommended the care coordinator consider referring Mrs. B to a social worker to help address the financial constraints, preventing her from purchasing much-needed products, such as incontinence briefs and a new mattress for her bed. I faxed my detailed consult note to Mrs. B's physician and followed up with the physician to discuss Mrs. B's medications and whether a referral to a urologist and/or a home visiting physician may be beneficial. Finally, after discussion with the care coordinator, we referred Mrs. B to our Independence at Home program, through which she is receiving more in-depth and ongoing support for many of her geriatric concerns. In doing so, I shared with my colleagues my initial assessment for them to build upon as they work with the client. Through these many interventions and with her care coordinator's ongoing support, Mrs. B is well supported and her specific needs are addressed through a variety of services and supports. Mrs. B is over for the time being. I remain available to her care coordinator as a resource in the event that Mrs. B develops further geriatric conditions or further specialized support is required.